Hello, and welcome back to the session. 6.13 International Healthcare Policy LO3 Understand Healthcare Provisioning. How do healthcare systems meet the needs of diverse populations? This video explores the complexities of healthcare provisioning, from planning and funding to delivery and coordination. Discover how these elements ensure effective healthcare systems worldwide. Healthcare provisioning involves organizing, delivering, and managing services to meet population needs. It encompasses service planning, funding, staffing, and access. Effective coordination across primary, secondary, and tertiary care is vital. This ensures continuity and quality of care. Understanding these elements is crucial for evaluating healthcare system effectiveness. Healthcare operates across primary, secondary, and tertiary care levels. Primary care includes GPs and community clinics, offering prevention and early diagnosis. Secondary care involves hospital services accessed via referrals. Tertiary care provides specialized treatments in regional centers. Coordination between these levels is key to seamless care. Funding and resource allocation are central to healthcare provisioning. Budget decisions affect service availability and quality. Publicly funded systems face resource limitations, leading to waiting lists. In mixed systems, access may depend on ability to pay. Equity concerns arise from these funding models. Workforce planning is crucial for effective healthcare delivery. Adequate numbers of trained professionals are essential. Poor planning leads to staff shortages and burnout. This affects service quality and patient safety. Strategic workforce planning links policy with operational delivery. Healthcare provisioning must adapt to population needs. Aging populations and chronic illnesses increase demand. Models focused on acute care may struggle long-term. Community-based and preventative services are vital. Adapting services ensures they meet changing needs effectively. Healthcare policy translation involves global guidance and local implementation. Global organizations develop policies based on international data. National adaptation aligns these with local structures and needs. Policies are frameworks allowing flexibility. Effective translation depends on national commitment and resources. National adaptation is crucial for policy implementation. Governments align global recommendations with local contexts. This involves integrating policies into national strategies. Local cultural and social conditions influence adaptation. Effective national adaptation ensures policies meet local needs. Service-level implementation translates policy into practice. National health authorities develop guidelines and allocate funding. Healthcare providers deliver care according to these policies. Training ensures professionals understand new requirements. Implementation success relies on clear guidelines and adequate resources. Monitoring and evaluation assess policy effectiveness. Countries collect data on health outcomes and service use. This data informs global health monitoring. Evaluation contributes to future policy development. Ongoing assessment ensures policies achieve intended goals. The United Kingdom's NHS provides publicly funded health care. It ensures universal access and organizes care by need. Primary care is the first contact point. GPs manage routine and preventative care. They refer patients to specialist services when needed. Secondary care involves specialist services accessed through referrals. It includes outpatient clinics and inpatient treatments. Tertiary care offers specialized treatments like transplants. These services are in regional centers. Coordination between care levels ensures comprehensive healthcare delivery. Integrated care systems coordinate health services in the UK. They involve NHS bodies, local authorities, and partners. This integration aims to improve collaboration and reduce duplication. It addresses health inequalities by merging health and social care. Effective integration enhances service delivery. UK healthcare funding comes from general taxation. It is allocated based on population needs. The workforce includes various healthcare professionals. They are regulated to maintain care standards. Adequate funding and workforce planning are crucial for effective service delivery. Several barriers affect healthcare provision in the UK. Workforce shortages and funding constraints are major issues. Infrastructure limits and access barriers further restrict services. Poor integration between health and social care adds pressure. Addressing these barriers requires coordinated strategies. Workforce shortages impact the NHS significantly. High workloads lead to burnout and retention problems. This reduces service capacity and increases wait times. Even with policy support, staff shortages limit policy implementation. Addressing shortages is crucial for patient safety and service quality. Funding constraints pose challenges for the NHS. Budgets often lag behind rising demand. This affects staffing, infrastructure, and treatment access. Providers prioritize urgent care over preventative services. Sustainable funding is essential for long-term system effectiveness. Infrastructure limits affect NHS service capacity. Many facilities operate at full capacity, causing delays. Limited hospital beds and equipment increase pressure. This affects emergency departments and treatment availability. Expanding infrastructure is necessary for effective healthcare delivery. Access barriers restrict healthcare provision in the UK. Long wait times and limited appointments are common. Geographic inequalities affect rural and urban areas differently. Digital barriers exclude some populations from online services. Improving access is vital for equitable healthcare. Poor integration between health and social care is a barrier. Delays in social care affect hospital bed availability. This increases pressure on healthcare systems. Integration issues highlight interconnected healthcare challenges. Effective integration is needed for comprehensive care. Addressing barriers requires coordinated efforts. Workforce planning and sustainable funding are key. Infrastructure development and improved access are essential. Integration between health and social care must be strengthened. These strategies enhance healthcare system capacity and effectiveness. In conclusion, understanding healthcare provisioning is essential for ensuring that health services are delivered effectively and efficiently. Healthcare provisioning involves the organization, funding, and delivery of services to meet the needs of populations. Different models of provisioning reflect variations in policy, resources, and priorities across healthcare systems. Understanding these approaches enables policymakers and professionals to improve access, quality, and sustainability of healthcare services in an international context. Thank you for watching this video. If you have any questions, please feel free to contact us via email or WhatsApp at 0748 4361688.